Good morning, everyone, and welcome to the Business Industry Call with Dallas County Judge Clay Jenkins. We're just waiting a few minutes for the judge to arrive. As soon as he arrives, we'll begin. Thank you for your patience this morning. Again, good morning, ladies and gentlemen. We are just waiting for Dallas County Judge Clay Jenkins to join us. Thank you for your patience, and as soon as he joins, we will begin our Business Industry Call with the judge. Good morning, everyone. Welcome to the Business Industry Call with Dallas County Judge Clay Jenkins. We are just waiting a few moments for him to arrive, so please place your line on mute, and as soon as he joins, we'll begin. All
Sorry.
right. Good morning, everyone. And thank you for joining us for our business industry call with Dallas County Judge Clay Jenkins. I'm Beth Bowman, and I have the privilege to serve as the president and CEO of the Irving-Las Chamber of Commerce and the Irving Economic Development Partnership. I'm here this morning on behalf of our board chairman, David Pfaff, who is unable to join us this morning. Judge Jenkins, thank you for your continued leadership over the past several months during this pandemic. We have many business industry leaders from across the county on the call today, and we appreciate your time and the information that you're going to be able to share with us. Again, for those attending this call, if you have any questions for Judge Jenkins, please type your question in the chat box at the bottom of the screen, and we will, as time permits, share those questions with the judge. So at this time, Judge Jenkins, good morning, and we'll turn it over to you.
Good morning. I just saw a question on the chat box. I'll start with that and then I'll get into COVID. The question was, federal troops have come into Portland without the locals' permission. Do I see a chance of that happening here? Anything is possible, but the situation is much different here. We don't have the level of civil unrest that is happening in Portland. In fact, Mothers Against Police Brutality and other groups that protest the police and the police chiefs and the city managers of Irving and Dallas and many other cities will be sitting down this afternoon on a Zoom meeting to discuss our differences and ways that we can move forward. We're having very productive discussions and happenings here in Dallas County. And so, I think the situation is different there. Please don't take anything of my comments to say that I'm making a comment in approval of the federal troops or I'm wading into that situation. I don't know a whole lot about that particular situation, but our situation here is on a different track. Switching to COVID, a few things going on there. So we are not going to be able to renew our lease with the University of Dallas. They need to start school. I don't know where that site will be going at this point. The way site selection works is Parkland Center for Clinical Innovation looks at where tests are short and where COVID is high and, moves the site into that. So if the hot zone is moved over 2 zip codes, one direction or the other, then the site will, if we can find the right place, will move in that way. We've opened a new site since we talked last. In fact, its first full day was yesterday. That's at Mountain View College. That site is available to you if you live outside of Dallas County, as well as if you live inside Dallas County. It's open from 8 to 2. The turnaround time is 2 to 4 days. Vendor tells me he thinks he can get it, or CEO of the vendor says they think it'll be closer to 2. We'll see, because as I said, it just opened yesterday. But at the Hanu side, at the Dallas University of Dallas site, we are seeing about 2 days right now. So 2 days is doable with these private labs. You do need to fit the criteria to get testing without symptoms. If you have symptoms, you can get testing. If you don't have symptoms, you need to be over 65 in one of those jobs that allows you to get testing without symptoms or have an underlying health risk. Let's turn to, we're also going to be opening a site, either we or the state, but basically it will be doing the work, but depending on who funds it, we'll open a site at Eastfield College near Mesquite on 30, Mesquite, Garland type area. So that'll be happening either later this week or early next week. And likely we'll open one more site south into some zip codes that are getting heavier. We'll have that announcement too, maybe Paul Quinn. So that's testing. We got rid of our federal testing where things were taking like 10 days to get a result back, which is useless. And so now we have this testing that's 2 to 4 days, so that's good. However, I do want to caution you on this. CVS testing in particular and others that are our partners are now running 10 to 12 days. Just kind of a pro tip for you if you need testing. The Dallas County sites, Dallas City, Dallas County sites are relatively fast. Your private insurance is relatively fast. CVS and Walgreens right now might not be so fast until we can get that resolved. I'll let you know how that goes next week. But right now there's pretty good backup there. And remember, they're all going to a national lab, and that's the problem, I think. Similar to the feds, if you send everything to the same lab, it just backs up. So that's testing. Tracing, some good news on tracing. Tracing is, so I get sick and someone calls me and finds out who my contacts are. Close contact, remember, is this is an important tip for employers. A close contact is anyone that you've been within 6 feet of for more than 15 minutes, 48 hours before the onset of symptoms through the duration of your illness. So if I've been around Beth, masked or not, now because there's not enough, we think probably if we're masked, there's low chance of Beth getting sick, but the data's not back from the test on that, from the national peer-reviewed test on that yet. But if I've been around Beth for 15 minutes, okay, so Beth and I work at a call center. Her cubicle is next to mine, and the cubicles are, separated by a little wall, but we sit like, within 6 feet of each other. And I'm sick, and a conscientious business might say, we need to protect Beth's health and everyone else's health, so we'll send Beth in for a COVID test. And Beth comes back negative. Beth can come back to work, right? No. We now know that Beth almost certainly will test negative, but may not be negative. And we have businesses all over Dallas, including Dallas County, who's figured this out the hard way in a couple of departments. They test somebody, they get a negative test, they bring them back to work. That person turns out to have the virus, they're shedding it and getting other people sick, but they don't show up with symptoms for another 2 days, and they don't show up with a positive test for another 4 days. And by the time it's all figured out, 8 or 10 more people are sick, and they've gotten a few people sick. And that can shut down entire departments or businesses. So the answer in our question of Clay's sick and Beth's is close contact is Beth needs to work from home. If Beth can't work from home, then Beth just needs to isolate at home and be off of work for roughly 14 days. That's the only way you're really going to have luck in keeping your business from getting sick, because we now know testing close contacts does not work, basically. You might find the only thing positive about testing Beth is if she is a positive, she has a peace of mind to know in her status. But if she's a negative, it probably doesn't mean a whole lot. Okay? So tracing, about 40% of the people that we're currently tracing are actually filling out the whole thing online on a new internet email system, text system. So that's a good thing. We're not able to trace every single person that gets sick each day and all their contacts. You say, well, why is that? Well, yesterday we had our lowest day since July 2nd, only about 750 new cases. But with an average of 10 to 12 contacts for each of those people, that's thousands and thousands of interview calls, which take anywhere from 25 to 45 minutes apiece for 290 people to make. They can't do that. There's not enough people, and they're training and ramping up people. There's just not enough. There's not enough in any of the surrounding counties or the state, and we fall further and further behind each day. something to keep in mind as you're making decisions out there, because, you know, tracing is part of keeping you safe, and that part's not really working very well. Let's see, what else? So we've written a letter to, we've talked about this, I think, since in our last couple of calls. We've written a letter to the governor with the doctor recommendations about closing businesses that you can't wear your mask 100% of the time. The governor hasn't done that, but it's wise for us as business leaders and as individuals to treat that as if that were the rule and not do those things. So examples of this, the biggest example would be in restaurant dining. It's just not possible for me and my family to be in one booth, and even though we're 6 feet away from Beth and her family, we had to take our mask off to eat. We're breathing. It's going out there. You've got a new compounded effect with the bars closed, that the bar hoppers are using the restaurants as bars. So it's really just not a good place to be at all right now. The patio's okay. I know it's hotter than heck. The patio's okay. Takeout, delivery, but they really encourage you not to go inside. You know, cigar bars and spin classes would be examples of places where you can't wear a mask 100% of the time. The doctors are actually studying some exercise classes. Like, now I'm not saying these are okay, but they were studying Pilates and yoga last night because there's some evidence that there's not enough breathing in Pilates and yoga for that one to be as bad. Spin class, definitely. When you're on that bicycle in that room, even though those bikes are, say, 8 feet apart or whatever, you're expelling about 20 to 25 times as much wind out of your lungs than if we're just talking to one another. So that's a really bad one for indoor activity. So treat those as if they're, you know, that's the rule. Here's the little good news for you. So and then emphasis probably unfortunately on a little, but we're at our highest number for hospitalizations. And if the numbers are correct, I'll report 30 deaths today, which is by far the most deaths that we have. But we did see a decrease in the number of new cases yesterday. We had 18 days at over 1,000. We had 748 yesterday. It's believed that the current mask mandate by the medical modelers will pay dividends for us. Obviously, if we would do more, if we would close the restaurant, in-person dining, we would restrict daycare to essential workers, the doctors believe we could do, you know, have a better chance. But the mask mandate itself will have a good impact. And they expect to see it later this month. So this is pretty late in the month. It's late July, early August, that to show up, you know, appreciably in the numbers. So we should start seeing that. I mandated mask here in Dallas County right a month ago, and the governor followed that, I don't know, a week to 10 days later. So therefore, Colin and Denton and Tarrant, the others have mask mandates at that point. So we should start seeing that. Schools, right now, schools in Dallas County are open or closed by order of the health authority and, for in-person education until September 8th. That number will probably go longer, unfortunately. But until September 8th, they can, though, have Zoom school or online school whenever they want to, when they normally start, which is August 17th. So there is a committee. It meets for the first time tonight of professors and doctors who work in the fields of child medicine, like child psychology or pediatric infectious disease, whatever, special needs learning, different things, who will get together tonight for the first time to discuss what ways to have a safe school experience for our kids. You know, I guess that's, the rent moratorium. Sorry about that. My dog's excited to bargain the mailman or something. The rent moratorium for Fannie Mae and Freddie Mac ends on the eviction moratorium for Fannie Mae and Freddie Mac ends on the 25th. The setting of new cases for eviction in Dallas County ends unless it's extended, which I don't think it will be, but well, anyway, it ends on currently on August the 5th. The requirement within the city of Dallas that people have 21 days notice of an eviction, and within that 21 days can ask to work out a plan or something and get an additional 60 days before the case can be filed, remains in the city of Dallas, not in the whole county. So that's the status of landlord-tenant right now. They're starting today on our website at dallascounty.org. People can see the information on the next round of rental assistance. Rental assistance in Dallas County goes to people outside of the city of Dallas who live inside the city, who make 80% or less of the average weekly wage for their family unit size for the Dallas area. So for a family of 4, I think it's around 65 grand. If they make that, they can apply for this. It's done on a lottery system. They can get up to $1,500 a month for 3 months to go towards utilities, mortgage payments, and rent. Also, also, there is another round of business assistance. Business assistance has been raised from $15,000 maximum to $50,000 maximum. The business must be smaller than 100 employees, and the business, must, of course, be in the city, not in the city of Dallas, but somewhere in Dallas County. And you have to keep employed 60% of your employees for 3 months after getting the loan. And then the loan is forgiven as a grant. And so that's pretty much all the information I have for you today. What questions do y'all have?
Judge, thank you so much for that overview and update from your perspective. It's so helpful for our business industry and stakeholders that are on the call today throughout the county. We do have a question. Within the county, are there any sites with rapid testing?
We have sort of. We're doing a rapid testing spit test right now at some of our sites where volunteers, they get their nasopharyngeal swab test, can then spit into the other test, and we're comparing, or not we, but the vendor is comparing the results to see how they match up. You can do the 15 minutes spit test, I think, in Tarrant County. And we did, I think it's over, but we did it at one of the sites yesterday. I mean, we're getting close to having enough confidence in that to start doing it, but I don't think there's any today.
Thank you for that. We have another question. What are as employers just look to prepare their employees, what is the statistical circumstances? So number of cases, 7-day averages for cases and or deaths that would dictate a need for Dallas County to go back to shelter in place?
For me, it's what those doctors on the public health task force say. And right now they're not recommending that. And of course, ultimately that's up to Governor Abbott, because when he took over all this, he said, you can't do shelter in place. Only I can close a business that's been specifically opened by me. I think we look to see what the doctors say, but ultimately the governor would have the say on that. And I think he's shown an unwillingness to do that. Excuse me. So
Bless you.
don't know if that will happen. I mean, it'll happen in a practical effect because people will just stop, the consumer confidence will shut down. And that's going to be a lot worse if that happens than, a 2-week pause. But if we don't take care of business, it'll happen one way or the other, that there'll be a shutdown, but it may be just a shutdown on the psyche of consumers. And that we certainly want to avoid.
Thank you for that response, Judge. We have another question in regards to the current mask mandate. It's expected to end in early August. What is currently being discussed about extending that mandate to keep everybody safe and healthy within Dallas County?
So I expect that it will be extended. It's right now it runs till the day after, or the midnight of the day of our next commissioners court meeting. That was the reason for that. I think clearly with all the evidence around masking, there'll be a move to keep that going. Gary's got a question on here about people that claim a medical exemption to come into the store, and some retailers are considering not allowing them in and offering curbside pickup or delivery. And I think that is a great idea. It's so much of this is about trust. And when people go to the store, I know there were a lot of people who actually emailed and texted me saying, "Thank God, I'm going to start going to Walmart because starting on Monday, or starting today, on Monday, because I know it's safe there now. I know everybody has to wear a mask." So a lot of these stores that have had the mask mandates which really, we already have a mask mandate, but they're getting big kudos and getting more folks showing up for that. If people show up to your store and then there's somebody walking around without a mask because they have COPD or because they have an anxiety disorder that won't allow them to wear a face covering, the other shoppers won't know it. They'll just know that, they were promised a masked experience. They didn't get it. So I think the curbside's a great idea.
Thank you for that, Judge, and Past Chairman Huddleston, thank you for that question. We have one other question. Will Dallas County be involved in legislation to develop liability protection against unwarranted lawsuits in essential businesses?
I don't know about legislation on that. When I was in charge of the rules before this Open Texas thing, I was willing, I worked with all the businesses to give them that by judge's order. And I can't, of course we can't do that right now, but we're still in which is kind of like, what does that matter? But if I still had the ability to do so, then that would be part of my orders to the liability protections for essential businesses. Certainly, and it depends on what it is. I mean, it could be an overreach. Somebody could, overreach. But yeah, generally, I favor liability, for essential business, liability protection rather, for essential businesses.
And Judge, how is the Dallas County Emergency Business Assistance Program going? I want to commend you and the Commissioner's Court for putting additional dollars to make sure our small businesses are receiving financial relief at this time. But any update on how that program's going through the county?
It's going okay. We're getting some, getting a lot of applicants, and a lot of them qualify. So I want to say this round, and I could be wrong on this, but I'm pretty sure I'm right, that this round closes on the 25th. So whatever that is, that's Saturday, I'm not sure. And then it's a lottery selection. And if you're in a round and you don't get selected small business, you're automatically enrolled in the next round. And so hopefully, you'll get selected at some point. I want to also remind people, there's another change in this last round for your small business. It used to be that if you'd received PPP or some other government subsidy, you could not apply for this. Now you can still apply for it. And if you qualify, you can get up to $50,000 if you qualify. But only if you have that much, in losses or that much in salary to pay, etc. So let's say you only qualify for 10,000, and let's say you've already received 5,000 from PPP, then all you get from this program is the other 5,000, right? What you qualify for minus what you've already received from other programs. So that's a change in the program too. At first you couldn't apply, now you can, and whatever you got from the feds is offset.
Judge, again, thank you so much for being willing to answer those questions. I know we are right at time and want to respect your demanding calendar. Any closing comments or words of wisdom for the over 100 business industry leaders that are on the call this morning?
A couple of things. By the way, Kroger is one of our partners. They still have a reasonable site, or reasonable turnaround time. It's less than, I don't know exactly what it is, but it's less than a week. I'm not trying to get anybody, I'm not grappling about anybody who's got a slow time. I'm just kind of warning you. But yeah, we will get through it. We know we'll get through it. This is a very long situation, and we're in the heat of summer, but we'll get through it just like they did in 1918 with the flu pandemic. And we get through it because leaders like you are staying focused on the science, right? You have faith in the science. You're not, you turned your fear to faith in science. And we're doing those things, those sacrificial things that are necessary to keep our employees and our community safe. You can get all that information at dallascountycovid.org, that color-coded cheat sheet from the doctors. They have updated that. I think they have some new recommendations for businesses in there, as well as maybe children and other recommendations. So give that a look, and make sure that you got that mask with you at all times. You never know when you're going to be on a walk and bump into somebody. But thanks for all the great work that you're doing, and just keep doing it.
Judge, again, thank you so much for your leadership. I want to thank everybody for being on the call today. Our next business industry call with Judge Jenkins will be Wednesday, August 5th at 10 a.m. Continue to socially distance, wear your face covering, provide sanitation to your hands and hand washing as often as you can if you must go out in public. Again, thank you all for your time this morning. And Judge, again, I think you see in the chat box, we are so thankful for your leadership and perseverance during this time. Have a great day.
Thank you. Y'all too.